Hi, my name is Kelly Ampistucha. I'm here at Eline Orthondontics in Frisco, Texas. Today, I want to tell you about a woman named Zamiris. She was very active growing up. She was a musician, she was a dancer, and she had big dreams of someday becoming a doctor. But she thought all of that could be jeopardized by her bite and her jaw. And to hear more about that, I have Zamiris here with me today, along with Dr. Yoon Chang of Eline Orthondontics. Dr. Chang, thank you for having us here today for this
It's my pleasure.
conversation.
So
and Zamiris, thank you for joining us.
Of course, thank you.
So explain to me what the problem was and how it affected multiple facets of your life rather than just eating and chewing.
Sure. So my entire life, I've had an underbite, and obviously chewing, eating was affected, but what I didn't know until I started treatment with Dr. Chang was that I actually had a crushed windpipe. Growing up, I had breathing problems, which led to heart conditions, and just it affected my physical ability to participate in the same way my peers would in music and band, as well as in dance as well. I did everything from ballet, tap, jazz, color guard. I played 3 instruments, and that is a lot of physical exertion. And I would start out fine, start out with a lot of energy, and then as practice or rehearsal would continue, I would eventually be coughing. I would have, to take a break and go off and sit and breathe and concentrate on my breathing. And I visited, plenty of other doctors, and no one knew what was wrong. My pulmonologist said I was fine. Lung development was pretty, on point for where I was. But for some reason, I just could not get any air into my body. And so eventually that led to me having to stop participating in those activities when I got to college.
And what was the outlook or recommendation from any other experts, orthodontists, doctors? Did anybody give you any advice or recommendation?
As far as, my regular physicians, I went to pulmonologists, and they said, well, maybe it's, the level of activity and she just needs to cut back. My cardiologists had cleared me of any issues that I had. I did have heart surgery at 16, but after that, after I was healed, I was completely fine. Cardiac wise, I went to other orthodontists, and it was just, well, you need braces and surgery to correct the underbite. There was no connection between my bite and how it was affecting the rest of my body and my other bodily systems. So I didn't figure any of this out until I saw Dr. Chang, and I saw the differences between my before and after x-rays, and found out that my windpipe was actually crushed compared to what it was supposed to look like, which was a fully formed tube. And so now realizing, oh, this is what was going on with me, had I found Dr. Chang sooner, it probably would have improved a lot of my health issues that I was having as a young kid.
And everything you were involved in.
Yes, that too.
And so all of the other experts, they all recommended surgery, right?
Mm-hmm. Yes, ma'am.
They said that was the only way
only way. I would have to have braces for 1.5 years to straighten my teeth, and then surgery.
And then the surgery?
And then the surgery. And then I would have 6 months with my mouth wired shut. So imagine, I can't speak. I can't play instruments. I can't eat. And I'm a foodie. So eating is important. And then after the surgery and the wires come off, I would have to have braces again for another year just to, I guess, settle everything into place. So that's like a 3-year process almost. Just to correct, an underbite. And, I'm the type of person, I believe there's more than one way to skin a cat. So I researched, took everything that they had, given me, all the information, and I researched, which is a good thing I was a history major and a science major, because
you knew how to get your
I knew how to get my
research
research done. And eventually I found, about 1.5 years ago, I found Dr. Chang and saw some of the testimonials and the videos of other people across the country who had used the same techniques that he had. And I jumped in feet first, head first, really, with no reservations. You know, this is something completely different. And so I figured, well, if it's different, it can't necessarily be bad. It might even be better. And it turned out to be so much better.
So let's turn it now to you. How is your philosophy different? Tell us first, you didn't agree with the recommendations for surgery that she had received in the past. Why? Why did you disagree?
Yeah, our bite is the result of a slow process of adaptation and compensation. A patient with an underbite or an open bite, that's something that the patient are not born with. They are developed into. So we have to understand the etiology of the problem. Once you correct the etiology, those conditions can be reversed. Of course, there are cases that will merit jaw surgery, extreme cases where the patient is born with some craniofacial disorder. Yeah, those cases will require surgery, but for the overwhelming majority of patients, the bite may be adapted back to a normal ideal bite without the need of jaw surgery.
And how do you do that? What was the when Zamiris first came in, what was your recommendation and what treatment did you embark on?
Exactly. Zamiris came with an open bite and underbite, meaning the lower jaw being pushed forward. But in all these cases, you see a strong contact of the molar teeth. So mostly the only teeth touching in your case was the molar.
Right.
So if there's a way to avoid that contact on the molar through orthodontics, which can be done using a different technique. It's a technique initially named multi-loop H-wise arch wire technique. It was invented in the US, perfection in Japan and in Europe. But with that technique, you can move the molar teeth down towards your bone, which is a movement that is super complex to do using traditional straight wire technique. So in Zamiris, we had moved your molars down and then avoid contact on the molars. When that happens, your jaw immediately knows that it needs to go back. Your jaw wants to go back to that ideal relationship between the upper jaw and the lower. And as the jaw moves back, I need to create that perfect environment. Upper arch needs to be wide enough to hold that lower jaw to allow the lower jaw slow repositioning. And that's what we did. And, it doesn't matter really the age. A human body has the capacity to adapt and compensate. And that is something that it is there. And as the jaw goes back, the airway improves. And with that, there are so many other medical conditions that will improve, from jaw pain to breathing issues to headaches to pain in other parts, neck, for example. And also changes in the body posture is something that we usually see.
Did you see any of those? What were some of the results that you were not expecting?
I was not expecting better sleep. I've always kind of had sleeping problems. I would wake up in the middle of the night, gasping for air. And, as a young child, as an only child even, my mother and father would definitely be always checking on me,
That was probably terrifying to
It
them.
was, absolutely. And then, compound that with all of the other issues I had going on with my heart and, just being able to breathe while I'm awake. It was just another thing to add on to the laundry list really, of issues I had going on. And after treatment with Dr. Chang, I found I sleep better. I'm able to go through the day without major migraines. I would also have major migraines all the time. Popping jaw, where you could literally hear my jaw cracking as if I was cracking my neck or my back or
like
something.
the person next to you would hear it.
Exactly. They would hear it. You would probably hear it, even as far as,
Wow.
away as you're sitting from me. And those things were really difficult to kind of go through at 11, 12, 13, 14, 15 years old. At one point, I kind of got used to it because it is mostly because I was receiving the same answers from everyone I was visiting, all the doctors, all the professionals. You would have to have surgery, but you would have to have it after you turned a certain age, after you would finished developing. So that was kind of what I was going through. And at that point, I'd almost, just give it up and was like, well, I guess I'll just live with my underbite. I don't look weird. No one really notices it until they see me smile or, they are looking at my profile. And I would move through life in that way where I would stand in groups of people so people aren't looking at my profile. I wouldn't take pictures from the side. It would always be like an angle view or, head on. And so now I'm, Tyra Banks from the side, anywhere you want me to be. But
Take an angle, any angle.
Any angle. And now I move more confidently through life and through any really experience.
Gotcha. Confidence that you need for the next journey of your life,
Yes.
which is
medical school.
Wow.
Yes.
We were talking about what field you wanted to go into, and your options were
cardiology or orthopedic surgery.
Or orthopedic surgery.
Yes.
And you particularly weighed in and said you voted for orthopedic surgery.
Orthopedic surgery,
and tell me why. Tell me what you said you think why that's perfect for Zamiris.
The connection between our body and teeth is so strong, especially when it comes to orthopedics. Medicine and dentistry, they are always separate. We believe most dentists believe that what we do in the mouth basically stays in the mouth without any connection to the body, but that's not the case. What we do in dentistry in general, especially orthodontic, is a huge change in the entire body. As the jaw, the mandible, relates to the upper jaw in a different way, that's going to have an endless repercussion from the neck bone all the way down to the feet. So I personally believe that orthopedics, that there might be a chance to decrease the need for orthopedic surgery through orthodontics.
Yes.
Yeah.
Wow, that would be that's beyond the realm of what I can understand. But talking with you today, I'm starting to get it. I'm really starting to get it. Are there any other experts in your field, any other orthodontists who share the same philosophy with you?
Yes, there are a lot of orthodontists sharing this philosophy. We call it craniomandibular orthodontics or even functional orthodontics. There are, but not so many in the United States. They're more well known in Europe, in Austria, Germany, Portugal, in South America, Colombia, Venezuela, of course in Japan, as the main professor is from Japan, Professor Sadao Sato. So there are many. Unfortunately, there's not too many in the US. But also the concept of integrative medicine and dentistry does not only belongs to orthodontics. In order for me to deliver your treatment, patient ideally has to be seen also by a myofunctional therapist and also a physical therapist, because I would like to not only achieve changes here, but throughout the body. And all parts of the body needs to be in tune or neutral in order to for the orthodontic result to be stable in the long run.
What are the arguments that you hear from other experts who disagree with you?
Of course, I used to be one of those.
Oh, okay.
Yes, I was taught, I graduated from Marquette University orthodontic program. I'm very proud of that. But when you talk to a traditional orthodontist, they see an orthodontic problem or malocclusion from a front to back problem or anterior to posterior. In your case, underbite, meaning your jaw was too big to hold the upper jaw that was pushed back. So that's why we believe in surgery. That's why, make the small part bigger, the long part shorter. However, if you analyze this condition, this is basically an adaptive condition. Teeth had moved longer, and then you had a growth period, and then there wasn't any other way for your body to move your jaw forward, because the position of your jaw is dictated by the length of your teeth. So if there's any way to reverse that through orthodontics, okay, and you can perfectly have your jaw back, and that's what this orthodontic treatment is about.
Are there other orthodontists who are also not using surgery but doing any other methods?
Yes, there are some other methods using mini implants, which are tiny metal screws that goes into your bone, and with that you may attach, use some elastic or any other devices to start moving your molars the lower molars inside of your bone to avoid contacts on your molar. That's very effective, but it is challenging for the patient as those mini implants may come out or may get infected, whereas with multi-loop H-wise arch wire or gunmetal H-wise arch wire technique, you just have a plain wire, almost like a conventional wire, but it's customized to fit your needs, and you'll only have to wear the rubber bands without the need of a screw device inserted into your bone.
Talk to me a little bit about the cost of what you're doing versus traditional surgery. And when I asked you this earlier, we talked about not just the bill that you get after your treatment, but everything else that comes along with it that adds up monetary-wise.
Yes, the cost of a typical surgical approach, includes not only orthodontic treatment, but surgery. And at the end, a good 3 to 6 months of recovery, a time where patient may not go to work or may not socialize as the patient wants. So if you add all that, that may be very costly. Surgery, all depends on the fees of the surgeon, but it becomes how can I say? I don't want to.
The numbers start adding up very quickly.
Yes, the cost of the surgery starts to add up very quickly. Whereas in this technique, we only charge for the orthodontic treatment. Yes, it is more costly than the traditional orthodontics, but you can avoid your surgery.
Are there any other advancements that you're still trying to discover? Any treatments that you're still discovering, or any questions that you still have that you're wanting answered?
Yes, not only me, but all the orthodontists in using this philosophy of treatment, integrative and functional orthodontic approach. We want to know what are the relationship between our jaw and our body. Okay, there are a lot of reports out there, from breathing to body posture to autonomic nerve system, but we want to document that. We want to gain more, data. And centers in Austria, here in the United States, a lot of places in South America, we are getting data to make the case strong and be able to publish in a journal.
So Zamiris, how has your life changed now, going into the future, than before your treatment?
It is great. The changes that I have now, experienced now since treatment with Dr. Chang, I couldn't have imagined. It's better than anything that I would have expected. I move through society better. I socialize better. I don't change my smile or, tell people not to take pictures of me from a certain angle because of my self-consciousness. I'm more willing to just kind of put myself out there and just go. I definitely smile more and show all of my teeth. I'm very proud of my teeth now, and I sleep better. I am more active, and it's not a problem for me to be active. It's just so many wonderful benefits that I've experienced now that beyond my wildest dreams. I'm speechless. Words really can't express how deeply I've been affected by the changes that Dr. Chang's treatment has provided for me.
How were you worried before that it would affect your future in med school?
Well, one of the main questions that I would get from medical school interviewers would be, how are you feeling now? In my personal statement, I would write about the challenges of my health and all of the things that kind of led me to wanting to become a physician, and my own personal health experiences were a major part of that. And so every interview I went to would be, how are you feeling now? And even though I would say, well, I'm okay, I'm good, it would always be, okay, but what if something else happens? And I never knew the correlation between my breathing and my bite. So I would still have breathing problems. I would still have severe, pain, waking up in the middle of the night, not being able to breathe. And I didn't know if these would continue, if this was just like a cyclical thing where it would be, I'm fine for a couple of years and then another issue comes up. So now I can actually say I'm better and there's nothing that I'm worried about happening anytime soon.
A very bright outlook for,
yes, absolutely.
for going into the future.
Absolutely.
Dr. Chang, if there's anybody watching right now who has the same issues that she had, what is your message to them?
I'll say that if you were told to have a jaw surgery to correct your underbite, open bite, facial asymmetry, or overbite even, we can provide you a solution, non-surgical solution, conservative solution, without extraction of bicuspids to treat your case, and also with a result that is going to be stable in the long run, and also providing a lot of health benefits.
Well, Zamiris, thank you for joining us
Thank you for having
today.
me.
Dr. Chang, thank you for inviting us here.
Thank you for having us.
We are here at Eline Orthondontics in Frisco, Texas. Thank you so much for watching.